Sickle cell anemia is a genetic blood disorder that affects how red blood cells work in the body. Instead of being round and flexible, these cells become stiff and shaped like sickles or crescent moons. This change makes it hard for blood to flow smoothly, leading to a range of health problems. Symptoms usually start to show up in babies around 5 to 6 months old, but what exactly should you look out for? In this video, we'll walk through the main symptoms, how they affect daily life, and the serious complications that can arise. Let's start by understanding the basics before diving into the details. Most children with sickle cell anemia don't show symptoms right at birth. Instead, the first signs typically appear between 5 and 6 months of age. This is when the body starts producing more of the abnormal hemoglobin that causes red blood cells to sickle. Parents and caregivers should be alert during this period, as early detection can make a big difference in managing the condition. Recognizing symptoms early helps ensure that children get the care they need to stay as healthy as possible. One of the first things people with sickle cell anemia notice is a constant feeling of tiredness. This happens because the body doesn't have enough healthy red blood cells to carry oxygen. As a result, you might feel wiped out, lightheaded, or short of breath even with normal activities. Everyday tasks can suddenly feel exhausting, and it's not just regular fatigue. It's a deep, ongoing tiredness that doesn't go away with rest. This is a key sign that the body is struggling to keep up. Pain crises are sudden, intense episodes of pain that can strike anywhere in the body, but most often in the chest, belly, joints, or bones. These episodes happen when sickle red blood cells block blood flow, causing sharp pain that can last for hours or even days. Pain crises are unpredictable and can be severe enough to require hospital care. Managing these episodes is a big part of living with sickle cell anemia, and they can disrupt school, work, and daily routine. Another common symptom is jaundice, which shows up as yellowing of the skin and the whites of the eyes. This happens because sickle red blood cells break down faster than normal, releasing a substance called bilirubin. When too much bilirubin builds up, it causes the yellow color. Jaundice can be one of the first visible signs of sickle cell anemia, especially in infants and young children. It's important to recognize the symptom early and seek medical advice. Dactylitis, or swelling and pain in the hands and feet, is often the first symptom parents notice in babies with sickle cell anemia. The swelling can be sudden and may make the baby fussy or uncomfortable. It happens when sickled cells block blood flow in the tiny vessels of the hands and feet. This symptom is a strong early warning sign and should prompt a visit to the doctor for further testing and care. Children with sickle cell anemia are at higher risk for serious infections. The spleen, which helps fight infection, can become damaged by sickled cells and stop working properly. This makes it easier for bacteria to cause severe illnesses like pneumonia or meningitis. Quick medical attention is crucial if a child with sickle cell anemia develops a fever or seems very unwell. Preventing infections is a key part of managing this condition. Acute chest syndrome is a serious complication of sickle cell anemia. It comes on suddenly with chest pain, fever, and trouble breathing. This happens when sickled cells block blood vessels in the lungs, leading to inflammation and reduced oxygen levels. Acute chest syndrome can be life-threatening and often requires emergency treatment in the hospital. Recognizing the signs early and seeking help right away can save lives. People with sickle cell anemia are at increased risk for stroke, even at a young age. A stroke happens when blood flow to part of the brain is blocked, often by sickled cells. Symptoms can include sudden weakness, numbness, trouble speaking, or confusion. Strokes are medical emergencies that need immediate attention. Regular checkups and preventive care can help reduce the risk, but it's important to know the warning signs. Splenic sequestration is a dangerous complication where large numbers of red blood cells get trapped in the spleen. This causes the spleen to swell and hemoglobin levels to drop quickly. The child may have pain in the left side of the belly, look pale, or feel very weak. This crisis can develop rapidly and is a medical emergency. Early recognition and treatment are essential to prevent serious outcomes. Sickle cell anemia can also affect vision. When tiny blood vessels in the eye become blocked by sickled cells, the retina can be damaged. Over time, this may lead to vision problems or even blindness if not treated. Regular eye exams are important for people with sickle cell anemia, especially if they notice changes in their sight. Early intervention can help protect vision and prevent long-term complications. Priapism is a complication that affects males with sickle cell anemia. It's a painful, long-lasting erection that isn't related to sexual arousal. This happens when sickled cells block blood flow out of the penis. Priapism can cause permanent damage if not treated quickly, so it's important to seek medical help right away. This symptom can be distressing, but fast action can prevent long-term problems. Managing sickle cell anemia is a lifelong journey. It involves regular medical checkups, staying hydrated, avoiding extreme temperatures, and taking prescribed medications. Support from family, friends, and healthcare teams is essential. With the right care, many people with sickle cell anemia can lead active, fulfilling lives. Awareness of symptoms and complications helps individuals and families stay prepared and proactive. Early detection of sickle cell anemia symptoms can make a huge difference in outcomes. Recognizing the warning signs and seeking medical advice quickly can help prevent serious complications. Newborn screening programs and regular health checks are vital for catching the condition early. Education and awareness empower families to take action and ensure the best possible care for their loved ones. Sickle cell anemia is a complex condition with a wide range of symptoms and complications. From early signs like fatigue and jaundice to serious risks such as stroke and acute chest syndrome, understanding what to look for is key. With early detection, proper management, and strong support, people with sickle cell anemia can live healthier, more active lives. Stay informed, stay proactive, and always reach out to healthcare professionals with any concern.